A report titled "The Burden of Major Musculoskeletal Conditions" states that bone and joint conditions are the most common cause of severe long-term pain and physical disability worldwide, affecting hundreds of millions of people. Dr. Donald Perry, part of Florida Hospital Waterman's Joint Replacement Center team, explains the impact deteriorating joints can have on your physical and mental well-being.
Well, basically osteoarthritis, rheumatoid arthritis. One thing that we've been seeing a lot of younger patients with is avascular necrosis, which is a condition that can affect the hip where a part of the bone of the hip actually dies. And that can be very crippling and very disabling, and it can come on very rapidly. The best thing you can do is maintain active lifestyle. Most of the injuries that I see in patients over 35 are from people who have reduced level of activity and start trying to be very, very active without slowly working their wear and tear. That is by far the most common problem that we see. In this area, most people think it's an older community, but a lot of the people in this area are very active. So I try not to discriminate against a patient because of their age. It really depends on their health issue. Now, obviously, it gets to a point where you may have diminishing returns, but I mean, I have a lot of patients in their 80s that have hip, knee, shoulder replacements, and they do just as well as some of the younger patients. We see a lot of sports injuries. Like I said, we have an older population and they're very active, so we have people that play softball, pickleball, basketball, tennis, and usually when we're doing surgeries, or when I do surgeries, I'm trying to get them back to whatever they were doing, whatever that may be. Well, that is our #1 goal. Our goal is to try to get them back to golf or any of the other activities that I mentioned as soon as possible. And a lot of people tend to think that, oh, I'm having a knee or hip replacement, it's the beginning of the end. And I think we've done a lot to try to reverse that, because most of the patients we can get, even after a knee or hip replacements, most of my patients, even the golfers, get back to playing golf within 6 weeks after the procedure, sometimes less than that.
For more information on the treatments available at Florida Hospital Waterman's Joint Replacement Center, follow the Joint Health Awareness Story icon at yourhometownhealth.com.